1590 WAKR with us live right now is another one of our great friends, and that's Dr. Joe Congeni from Sports Medicine Center at Akron Children's Hospital joining us. And, Joe, where would you like to start this morning as far as sports medicine?
You know, a couple things. Just two things happened in the world of sports medicine, I think, that everybody's talking about around town and at our office. Still the issue, the continuation of the J.T. Barrett story. I mean, that happened after we spoke last week. We had talked about and thought that probably this was a meniscus flap type issue last week for it to come down the way it did with getting hit by a camera person and the knee locking up and not being able to finish the game and so forth. But we were all surprised, I think, when he was operated on Sunday and the information was released mid to late week that he was going to be ready to play. And so in my experience, everybody was asking me, you know, is that unusual for getting a scope, arthroscopic surgery? Remember, arthroscopic surgery is an instrument about the size maybe of a pen hole, a small hole that we put into the knee, a scope so you can see what you're doing and how you're working, and then another hole that you can work through and trim. And cartilage like that usually doesn't have much blood flow. It's not a big job to trim that cartilage away, but the bigger job is going into the knee with that scope and a couple of stitches to close that up when you're done and some secondary swelling after. And I asked actually our chairman of orthopedics at Akron Children's Hospital, Dr. Kerwin Jones, geez, Kerwin, what's the quickest in one of your patients? And he remembered a wrestler that he'd gotten back in 2 weeks. For me, in 30 years, I had one person with a scope that got back in 3 weeks. But the biggest thing people tell us after a scope, although it's not real invasive, as long as they're not doing a lot of work, and with this flap tear, they didn't have to do a lot of work in the knee, apparently, for J.T. Barrett. But a lot of people complain of kind of a wobbly feeling, like a jello-like feeling of the knee for the first few days to weeks after they've had even the scope surgery done. And the real big deal is the rehabilitation. And there was reports out there that J.T. Barrett was rehabbing 14 to 15 hours a day last week to try to prepare himself for that game. The second issue would be with swelling. Is there some secondary swelling around where the work was done that would cause you to have loss of motion of the knee and perhaps some pain in the knee? So there was speculation, perhaps did he get a shot to try to control the swelling, to try to control the pain? And the other thing you saw was that he did wear a brace for that unstable feeling. But certainly they did not use him as a game manager or not throw him into the fray. He did everything that night on Saturday night as far as running, sprinting, playing. So he rehabbed. He wore a brace. He may have gotten a shot. They never did say for sure for the swelling and pain. But 1 week was really a short period of time to return.
I know some people, Joe, who aren't in the athletic arena who have that type of injury. And basically, they will lock up, but they're able to work it around, and they're able to loosen up, and it gets on out of there. If someone has that, you know, just the weekend athlete and such, would you recommend them going in and getting that procedure?
Oh, yeah. I mean, when you said it last week, a trick knee to where it's really locking up and it's coming from cartilage that doesn't have a good blood flow and is not going to heal anymore. If you're getting that on a fairly regular basis, it's just such an easy thing to evaluate it and get rid of it. If it's a small one, if it's a very large tear, if it gets into the place where there is blood flow, we call it the red zone, Ray. If it's into the red zone, then it's repairable where they put sutures in it. Then it may be 2 or 3, 4 months before they're back playing, and that's confusing for people because if it's in the red zone where it's repairable, it's better for your long term because you're not having to take that cartilage out that you need versus this type of surgery where it's more so in the area where there isn't a lot of blood flow. You just take it out. That's easier. But when you repair it, it's a longer period of time. And so, but the outcomes are usually better. But for somebody where it's in the area where it doesn't have a lot of blood flow, very easy to take it out. It's not such a big deal to trim it, and people do very well and tolerate arthroscopic surgery. And, of course, 20 or 30 years ago, what a great advance that was in technology to have the scope. It's just a little bit tight to think about. It's not like nothing at all to think about playing on it in 1 week.
Was there something else on as far as
I did want to mention There was a story, and a few people have brought this up to me too, from a South Carolina State basketball player who collapsed on the bench this week. And just another one of those that any chance I get for people on the sports medical team or in a situation perhaps where a trainer wouldn't be there. He collapsed. They very quickly, within the first minute, they didn't sit around for a long time. They didn't say, hey, run around and make sure you have the AED and everything. They started right into CPR. The South Carolina State athletic trainer started CPR. The game was at North Carolina State University. Their trainer ran immediately to get the AED. They had the AED on the chest of this basketball player within a minute, they said, a minute or two. They started CPR. He actually, before he left the gym, was speaking to them, was back. They brought him back, his heart back. In the background, actually, when they were working on him, you could hear his mom in the background saying, please, I can't lose my son right now, and screaming out. And so amazing that they jumped into action. And this is the way trainers are trained. And when you see a great save like this, he rode in the ambulance, was fully alert, everything turned around because they got to him early. And this is what certified athletic trainers can do in the field. Again, a lot of times you see them sitting there, you see the medical team, hey, what are they doing at a game? Well, they're there for a situation like this, and this was a story of another great save down at North Carolina State University. And the point is alertness of seeing what happened and then jumping into action. This is one of those things. You don't wait 5 minutes, you don't wait 10 minutes, you start in the first minute, and it was a great outcome for this young man from South Carolina State University.
All right, great stuff, Joe. Thanks for coming on with us, Sports Medicine. We'll catch up with you next week.
Have a great week, Ray.
You too. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, joining us live again. Joins us most Wednesdays at this time.